A man is recommended by his primary care doctor and is diagnosed with hypochondriasis when he arrives. What is the very first, most important step in treatment? A. Establishment of trust and appreciation for the patient's problems. B. History taking. C. Treatment planning. Which of the following is a difference between professional ethics and professional values? A. When a social worker makes an ethical judgment, you can assume it is a judgment that also upholds professional values. B. Values deal with what is right or wrong in practice, and ethics deals with the principles of practice. The purpose of feedback in a social worker interview is to A. Allow the social worker to confront distortions in the client's thinking. B. Allow the social worker to self-disclose for the benefit of the client. C. Let the client know the social worker understands the issue. The desire to fight again is present in a soldier who has post-traumatic stress disorder connected to battle. Which action should you take first? A. Inform the client that return will likely cause an increase in symptoms and is not advised. B. Assess progress in treatment and current level of functioning. How can the median of a collection with an even number of entries be determined? A. Find the average of the two middle numbers. B. The larger of the two middle numbers is the median. C. A set with an even number of items does not have a median. Beck says that a depressed individual is unable to appreciate the advantages of his or her circumstances because A. Lack of support. B. Precipitating factors. C. A dysfunctional schema. What should be evaluated first when doing basic crisis intervention on site, such as in the wake of a natural disaster? A. Trauma response. B. Future mental health risk. C. Immediate needs for physical safety, food and clothing. The best example of the educational component of supervision is A. Monitoring the caseload. B. Providing in-service training. C. Utilizing individual and group conferences. D. Refining knowledge and skills. A 7-year-old boy refuses to spend the night in his bed. He is fine when his parents sit with him in his room. He starts to sob as soon as they leave the room. He stops sobbing when they enter again. This is an illustration of A. Punishment cycles. B. Operant conditioning. C. Higher order conditioning. The social worker makes the client want to be happy because he makes her think of her father. Which of the following statements is true about the client? A. Countertransference. B. A dual relationship. C. Transference. Alzheimer's disease is frequently misdiagnosed in older people when the correct diagnosis is A. Depression. B. Anxiety. C. Delirium. D. Thyroid disorder. A female customer, 22, is thinking about getting an abortion. Her social worker strongly supports abortion and is pro-choice. Which of the following should the social worker in this case do first? A. She should ask the client to share her rationale for choosing an abortion. B. She should talk with the client about abortion alternatives. That which follows does not constitute institutional discrimination. A. Not providing translation services or agency paperwork in any language other than English. B. Only offering therapy and other services on Saturdays. C. Referring a client to another social worker based on his or her cultural background. When using a token economy, which of the following is not always true? A. Points or rewards must be consistently given when the targeted behavior is exhibited. B. For the system to be effective, a substantial number of points or rewards must be taken away for undesirable behavior. In adult survivors of childhood sexual abuse, the most frequently encountered defense mechanism is A. Denial. B. Intellectualism. C. Suppression. D. Projection. A client with a history of drug abuse was referred to a social worker by a concerned relative. The social worker should first A. Conduct a family interview. B. Begin treatment, focusing on the reason for the drug abuse. C. Refer the client for substance abuse treatment. Parents continually refuse to communicate with their child who is in a residential treatment facility. The social worker should first A. Respect the parent's need for separation by not contacting them. B. Request that the child be discharged. C. Assess the child's response to the parent's actions. Common indicators of sexual, physical, and emotional abuse include all of the following except A. Violence against younger children. B. Sexualized behavior. C. Isolation. D. Stuttering. The concept of gender roles is best defined as A. Attitudes and behaviors attached to individuals because of their sex. B. An individual's sex orientation and/or preference. C. Biological characteristics that influence an individual's behavior. Which type of interviewing question is most likely to generate client defensiveness? A. Open-ended. B. Closed. C. Leading. D. Why? When interviewing a client whose speech patterns are different from the social worker's primary consideration should be that A. Communication patterns vary due to economic conditions. B. Speech is influenced by culture and experience. C. Psychosocial conditions will cause variations in speech. The initial symptoms of schizophrenia most often occur between which of the following years of age? A. 6 to 12. B. 13 to 16. C. 17 to 45. D. 16 to 60. Which of the following approaches would be most appropriate to use in evaluating client satisfaction with the social worker's provision of services? A. Using a single system design, evaluate the quality of services. B. At termination, ask clients to complete a service evaluation and satisfaction form. When conducting an assessment of the risk factors of child abuse for a child of a different ethnic background, a social worker must first: A. Be aware of how personal cultural biases affect the social worker's ability to deal with issues of diversity. B. Realize that assessment models are not a substitute for clinical judgment or experience. A social worker is receiving a client with long-standing depression. It becomes known that the client has racist beliefs. The social worker should: A. Respectfully confront the client's prejudiced beliefs. B. Educate the client about the negative effects of racism. C. Respect the client's beliefs and focus on the presenting problem. A social worker is conducting an initial assessment with a client. What is the best way for the social worker to inquire about the client's sexual orientation? A. Do you consider yourself to be gay or straight? B. Tell me about your sexuality. C. Are you attracted to men or women? According to Beck, a depressed person does not see the positive aspects of his or her situation because of: A. Precipitating factors. B. Lack of support. C. A dysfunctional schema. D. Lack of adaptive coping strategies. It is necessary to obtain informed consent before giving out data about a patient. Which of the following statements is most correct regarding this issue? A. You must obtain informed consent from your patient in most situations, but not in all situations. B. If a significant other requests information about your patient, you may release it without informed consent. A man is referred by his primary care provider and presents with a diagnosis of hypochondriasis. What is the first crucial step in treatment? A. Establishment of trust and appreciation for the patient's problems. B. Education about the link between stress, emotions, lifestyle, and physical health. How do you find the median of a set with an even number of items? A. The larger of the two middle numbers is the median. B. The two middle numbers are both medians. C. Find the average of the two middle numbers. The phase of the helping process which leads to the subsequent implementation of the intervention is: A. Exploration and summation. B. Exploration, assessment, and planning. C. Initiation of established rapport. D. Clarification and analysis. When treating elder adults with depression, the best approach to treatment is: A. Cognitive behavioral therapy coupled with family interventions. B. Coordination between medical and mental health due to the influence of medical conditions on psychiatric symptomatology. Professional ethics and professional values differ in which of the following? A. Values are a subset of ethics. B. Values deal with what is right or wrong in practice, and ethics deals with the principles of practice. C. When a social worker makes an ethical judgment, you can assume it is a judgment that also upholds professional values. What is the first thing to assess in on-site basic crisis intervention, such as in the aftermath of a natural disaster? A. Immediate needs for physical safety, food, and clothing. B. Trauma response. C. Future mental health risk. A social worker receives a new client who is seeking cognitive behavioral therapy, which is not the social worker's treatment expertise. The social worker should A. Attempt this intervention. B. Refer the client to an expert. C. Explore the client's reasons for wanting cognitive behavioral therapy. A social worker is interested in conducting a study of drug use among adults of different ethnic backgrounds. Which of the following sampling strategies is most apt to yield a sample that reflects the ethnic composition of the area? A. Simple random sampling. B. Convenience sampling. C. Stratified sampling. Which of the following approaches would be most appropriate to use in evaluating client satisfaction with the social worker's provision of services? A. Using a single system design, evaluate the quality of services. B. At termination, ask clients to complete a service evaluation and satisfaction form. The primary role of a social worker is A. Building rapport. B. Providing support systems. C. Acting as a resource. D. Curing emotional or mental dysfunction. A 40-year-old male client explains that he is seeking care because he suffers from panic attacks. He notes that he gets chills, nausea, dizziness, and experiences fear about once a day. A social worker's first step with this client would be to A. Teach relaxation therapy. B. Set goals for reduction of anxiety. C. Assess the client's current situation. In a task-centered treatment approach, once a social worker establishes the client's needs, which of the following is the best option? A. As the expert, the social worker should be the primary person to establish the treatment goals. B. The client and the social worker should jointly establish the treatment goals. In facilitating a hospital support group for bereaved parents, a social worker can discuss a personal experience of the death of a child to A. Create empathy with the participants. B. Receive help from the group. C. Create a sense of shared experience. Then interviewing a client whose speech patterns are different from the social worker's, the social worker's primary consideration should be that A. Communication patterns vary due to economic conditions. B. Speech is influenced by culture and experience. C. Psychosocial conditions will cause variations in speech. All but one of the following are National Association of Social Workers, NASW, standards for cultural competence. A. Social workers should endeavor to seek out, employ, and retain employees who provide diversity in the profession. B. Social workers should work with diverse clients only if they have had specific training in that client's unique cultural background. Encapricis is defined as A. The voluntary or involuntary passage of stool in an inappropriate place by a child over the age of 4. B. The voluntary or involuntary passage of stool in an inappropriate place by a competent adult. C. Deliberate fecal incontinence only in a child over age 4. The following criteria are all used to distinguish substance abuse from substance dependence, except A. Symptoms of substance abuse are usually less severe than those of dependence. B. Substance abuse typically involves narcotics, while dependence typically involves non-narcotic drugs. Focusing on intervention processes, this part of the exam covers assessment methods and best practices surrounding intervention. A. Assessment and intervention planning. B. Interactions with client systems. C. Professional relationships, values, and ethics.